So the topic of this talk is suckling dairy calf nurse cow system and gastrointestinal infection during the first grazing season. And can it be considered as a diluting strategy to reduce anthelmintic treatment? This work is a part of the PhD thesis of Caroline Constancis, who was unfortunately not available to present herself his study. It was funded by the co-organic in the Grazing Daisy project. So as a background, we can say that the classical rearing of dairy calves in farming, conventional or organic farming, is an early separation from the dam, and then a breeding of calves at individual and collective level in pens with milk distribution. So the weaning classically is at around 3 months to 3 months of age, and the turnout is at different ages according to the season, from 9 to 15 months, sorry. So new practice has been developing since 2010 in Western France by farmer, not only in Western France, but also in center and in Eastern part, but especially in Western France, in order firstly to promote calf grazing and growth while decreasing neonatal diseases, and secondly to reduce work related to calves rearing. So in this new system, there is a classical first phase of rearing with a dam during 5 days around, in barn or on pasture. And what is new is a fostering phase, an adoption phase by a nurse cow in barn at around 8 days of age for the calf, and a turnout as soon as possible. One nurse cow can foster around 1 to 5 calves and 2.5 on average until weaning. So we have very few data regarding the health consequences of rearing dairy calves with nurse cows until weaning. What we know is that during the neonate phase, it is a phase which is characterized by the neonatal diarrhea, especially with bacteria, virus, and Cryptosporidium. We have two papers, one showing that we have a lower frequency of diarrhea in general, and a second paper which is submitted by Caroline Constancis. It's the first part of her PhD thesis, which shows that there was a lower excretion for Cryptosporidium compared to a classical system. But we have really nothing as information during the grazing phase regarding gastrointestinal nematodes. So we may have some question. Is it this system, is it a risk increase, in fact, due to a turnout on an early age and a longer grazing duration? Or in contrary, is it provoke a decrease in the risk of gastrointestinal nematode infection due to mixed pasture with adults? So I have to mention that this system for dairy calf is somewhat different from the co-calf system for beef cattle due to the ratio calves adult, which is different. So the objective of this work was to evaluate the level of gastrointestinal infection of first grazing season calves raised with nurse cows. So we work in 30 organic dairy farms located in northwestern France, as you see on the map. At the end, we had 38 groups of calves crossbred and a mean of 2.6 calves per nurse. The first visit was in August 2018, and the second visit was in wintertime from October to mid-January to perform fecal and blood sampling at housing for each calf. So we realized a fecal egg count using mini flow tach according to Quengoli and pepsinogen concentration in unit tyrosine according to Kerber technique. So what were the results? Regarding grazing system, we have 32 groups which were born in spring and 6 born in autumn. The turnout was between February to October at the age of 44 days as a mean, minimum 0 when calving was outside in pasture, and maximum 100 to 20 days. The mean duration of grazing season was around 195 days, with a huge range for these parameters from 70 days to 300 days. The weaning was at 9 months of age, mainly from in September for the spring calving, and the rest in housing. There was a big diversity in grazing management, from a set stock grazing system to pasture rotation system with return, or an invasive system with rotation. So regarding the selection of nurse cows, the main criteria were persistent subclinical mastitis for 45% of cows, but also infertility, 17%, and milking issue and lameness for 9% each. Regarding the parasitological indicators for the dairy calves, the mean group fecal egg count was 130 PG. When considering individual level, we have 38% of calves having more than 100 EPG and 2% only more than 500 EPG. This last threshold was considered as a clinical threshold, and of course, a production threshold too. Regarding mean group pepsinogen, the mean value was 1.12 unit tyrosine, 30% was above 1.5, and 0% above 2.5 unit tyrosine. This last threshold is considered by CareBuff as a threshold with clinical or with production problem issues. Regarding anthelmintic treatment, we have only one treatment for 17 calves out of 464. It means only 3% of animals which were treated once. So we can give some additional data obtained from the subsequent follow-up during the year 2019. This follow-up was made only on 20 farms, 400 calves with 29 groups, and 4 sampling periods during the grazing season. When we consider the table and the results obtained at housing, we can see that it's quite similar to the results a year before in 2018. 131 EPG, for the pepsinogen 1.42, and we had for this follow-up the determination of ELISA ostataja in ODR, and the mean value was 0.55. Regarding the production, the mean average daily weight gain of calves was around 780 grams, and for nurse cows, the fecal egg count was 14 EPG. So this indicator for parasitological data suggests that we have a lower level of gastrointestinal nematode infection compared to standard system of dairy calves rearing, I mean weaned animal at turnout and grazing on specific pasture. This comparison was made in the same area, Western France. So on the table, you can see the value of the study for the 2 years and the value obtained by Aurélie Merlin in 2017 in standard organic or conventional system. And you can see that the mean value for pepsinogen were higher in the standard system with 2.25 and 2.19. And it was exactly the same for Ostatagia ODR with value higher in the standard system at 0.79 or 0.87 compared to 0.55. Similarly, the difference also was, of course, for the age at turnout in months. It was 1.5 in the system with nurse cows, and compared to 8.5 or 9 months in the standard system. For grazing duration, the comparison is quite difficult because, in fact, we have a huge range of value considering the date of turnout and the calving date also. So the mixed grazing between dairy calves and adult nurse cows at the ratio of 1 cow for 2.6 calf can be considered as a diluting strategy, which can be explained by a cleansing effect of adult ingesting larvae and expressing few eggs. Moreover, suckling calves, of course, ingest grass progressively with larvae, infective larvae, together with milk intake. So a longer and an earlier first grazing season seems feasible without or with little anthelmintic treatment together with satisfactory weight gain. Of course, an in-depth analysis of risk factor between groups will be performed on this data set. And I have to mention that complementary data are needed about the specific risk and issue of Dipterococcus infection, both in calves and cows, and that we are interested also in the level of immunity to gastrointestinal nematode expressed during the second grazing season by this dairy calf with nurse cows. So I would like to thank INRAE and Pays de la Loire Region for funding the PhD grant, and Crazy Daisy Project and Core Organic for funding, and of course all the technicians and all the farmers who participated to this study. Thank you very much.
Thank you, Christophe. We are running a bit late, so we have the most popular question, because there are several. Are there any coproculture results in your study?
Yes, we have. It's mainly Cooperia and Ostertagia. So it's quite similar to the result obtained with a standard rearing system. Okay,
maybe then a quick one, because there are many votes in this one. In the Netherlands, we had a massive drought in 2018 and 19, having a huge effect on GIN infections. What was the situation in France in those years? And could you compare, therefore, with 2017 because of the droughts?
Yes, you're right. It's quite difficult always to compare different pasture season. And unfortunately, we have some drought in this area for many years, so including 2017 and 16. So I think it's more or less comparable, but of course, it's a problem to compare different seasons. I agree with that, of course.